For stronger legs, older adults should include these 3 vitamins in their nightly routine. You have been misled. Many are told that aging alone causes their legs to weaken. But that is not the full truth. The real cause often lies in a hidden deficiency of 3 vital vitamins your body needs to restore leg strength while you sleep. Before we reveal the solution, please take a moment to like this video and subscribe to the channel to support our mission of bringing you vital senior health tips. What no one is revealing is these nutrients are natural, affordable, and not very profitable. That is precisely why you will not see them promoted on television or social media, and why most doctors do not talk about them. Yet the scientific evidence is clear. Lacking just one of these vitamins can triple your risk of falling after the age of 60. Furthermore, this deficiency can delay muscle repair by 37% and raise the chance of leg cramps by 42%. Today we will reveal the top vitamin for restoring leg strength. Even though it has been proven to increase strength by 31%, very few seniors take it. Here is everything you need to know. Before we dive into the 3 specific vitamins, you need to understand why taking them at night changes everything for your leg muscles. Most people think muscle building only happens at the gym or during exercise. But here is what really matters: your muscles rebuild themselves while you sleep. Specifically, between the hours of 10 o'clock in the evening and 2 o'clock in the morning, your body releases its highest levels of growth hormone. This is the hormone responsible for repairing damaged muscle fibers in your legs, your thighs, and your calves. During deep sleep, blood flow to your muscles increases by up to 50%. This surge in blood flow delivers the nutrients and building blocks your leg muscles desperately need to recover and grow stronger. But here is the problem: if those specific nutrients are not in your system before bed, your body cannot complete the repair process. Consequently, your muscles break down faster than they rebuild. Think of it like this. Imagine you are a construction worker trying to rebuild a house at night, but someone forgot to deliver the lumber, the nails, and the cement. You can show up ready to work, but without the materials, nothing gets built. That is exactly what happens to your leg muscles every single night when you are missing these 3 vitamins. Your body tries to repair your muscles, but without the right materials, the job never gets finished. Research from the Journal of Clinical Endocrinology shows that seniors who optimize their nighttime nutrition experience 41% better muscle protein synthesis compared to those who do not. That means stronger legs, better balance, and more independence. The timing matters just as much as the vitamins themselves. Taking these nutrients in the morning or afternoon simply does not give you the same results. The first vitamin your legs need every night is vitamin D3. It is important to note that this must be specifically the D3 form, not just any vitamin D. Now you might be thinking you already get enough vitamin D from the sun. But here is what the research shows: after age 60, your skin becomes 50% less efficient at producing vitamin D, even if you spend time outdoors. Vitamin D3 is critical for leg muscle strength because it directly activates the genes responsible for building muscle protein. Without adequate D3, your muscle cells cannot properly respond to the signals telling them to grow and repair. A groundbreaking study published in the Journal of the American Geriatric Society followed 4,100 adults over the age of 60 for 3 years. Those with optimal vitamin D3 levels maintained 27% more leg muscle mass compared to those who were deficient. But it gets even more specific. Vitamin D3 works directly on what scientists call type 2 muscle fibers. These are the fast twitch fibers in your legs that give you the power to stand up from a chair, climb stairs, and catch yourself if you stumble. After age 50, you naturally lose type 2 fibers faster than any other muscle type. Vitamin D3 is one of the only nutrients proven to slow this loss and even help rebuild these critical fibers. Here is why nighttime D3 is so powerful. When you take vitamin D3 before bed, it is in your system during those peak muscle repair hours we discussed. Your body can immediately use it to activate muscle-building genes while you sleep. Research from the University of Birmingham found that seniors who took vitamin D3 at night experienced 31% greater improvements in leg strength over 12 weeks compared to those who took it in the morning. Now, let us talk about what happens when you do not have enough D3 in your system. Your legs become weaker, obviously, but the real danger is what happens to your balance and coordination. Low vitamin D3 levels impair the nerve-muscle connection in your legs. This means your brain signals take longer to reach your leg muscles. That split-second delay can be the difference between catching yourself and falling. Studies show that vitamin D deficiency increases fall risk by up to 300% in older adults. You might also notice your legs feel heavy or tired all the time. That is because without adequate D3, your leg muscles cannot efficiently use the energy stored in your cells. It is like trying to run a car on bad fuel. Many seniors also experience persistent leg pain and weakness that doctors cannot explain. Often it is simply severe vitamin D3 deficiency masquerading as something more serious. So, what is the right amount of D3 for rebuilding leg muscle at night? Most experts recommend between 2,000 and 4,000 international units taken before bed. But here is what is critical. You need to take D3, not D2. The D3 form is significantly more effective at raising your blood levels and reaching your muscle tissue. Look for a supplement that combines D3 with a small amount of healthy fat like McDoyle. Vitamin D3 is fat-soluble, which means it absorbs better when taken with fat. One important note, if you have been deficient for years, it can take 8 to 12 weeks to fully restore your levels. Don't expect overnight results, but many seniors report feeling more stable on their legs and having more energy within 4 to 6 weeks. Always check with your doctor before starting any supplement, especially if you are on medications, as vitamin D3 can interact with certain heart and blood pressure medications. Chapter 5, Vitamin number 2, Magnesium Glycinate. Vitamin D3 is your foundation, but it cannot rebuild your leg muscles alone. It needs help from vitamin number 2, which might surprise you, magnesium glycinate. The second vitamin your legs need every single night is magnesium, specifically magnesium glycinate. You have probably heard about magnesium before. Maybe someone told you it helps with sleep or cramps. But what almost no one understands is how critical magnesium is for actually rebuilding the muscle tissue in your legs while you sleep. Here is what magnesium does for your leg muscles. First, it regulates over 300 enzymatic reactions in your body, and at least 27 of those are directly involved in muscle protein synthesis. That is the process of building new muscle fibers to replace old damaged ones. Without enough magnesium, your body physically cannot complete the chemical reactions needed to build muscle. It is like trying to bake bread without yeast. The ingredients are there, but nothing happens. Second, magnesium controls calcium flow in and out of your muscle cells. This is absolutely crucial for understanding leg cramps and muscle tension. When you do not have enough magnesium, calcium floods into your leg muscle cells and gets stuck there. This causes your muscles to contract and stay contracted, which is exactly what a cramp is. That is why your calves seize up in the middle of the night. Magnesium is what allows your muscles to relax and release that trapped calcium. A study in the American Journal of Clinical Nutrition found that seniors with optimal magnesium levels had 42% fewer nighttime leg cramps and 29% better overall leg muscle function compared to those who were deficient. But here's what makes nighttime magnesium so special. When you take magnesium glycinate before bed, it does not just help your muscles relax so you can fall asleep. It stays active throughout the night, supporting every phase of muscle repair. During deep sleep, your leg muscles go through cycles of relaxation and microcontractions, which is a normal part of the repair process. But if you do not have enough magnesium, those microcontractions can become full spasms that wake you up or prevent deep restorative sleep. Poor sleep means poor muscle repair, and poor muscle repair means weaker legs. It is a vicious cycle, and magnesium breaks that cycle. Now you might be wondering why I keep saying magnesium glycinate instead of just magnesium. Here is why this matters. There are many forms of magnesium, such as magnesium oxide citrate, sulfate, and glycinate. Most drugstore supplements use magnesium oxide because it is cheap, but your body absorbs less than 4% of magnesium oxide. Magnesium glycinate, on the other hand, has an absorption rate of nearly 90%. Plus, the glycinate form does not cause the digestive upset that other forms do. Let me tell you what happens when your legs do not get enough magnesium. First, you will notice persistent muscle tightness. Your calves, your thighs, even your feet will feel stiff and uncomfortable, especially in the evening. You might struggle to stretch or feel like your muscles never fully relax. Second, muscle recovery after any activity takes much longer. A walk that used to leave you pleasantly tired now leaves your legs aching for 2 days. Third, you become more prone to muscle strains and tears because without adequate magnesium, your muscle fibers are brittle. They cannot handle the normal stress of daily movement, so even simple activities like stepping off a curb can cause injury. Studies estimate that 70% of Americans over 60 are deficient in magnesium. That is 7 out of every 10 seniors walking around with weaker legs than they should have, all because of a simple, fixable deficiency. So now you know about vitamin D3 for muscle building signals and magnesium glycinate for muscle repair and relaxation. But there is one more vitamin that ties everything together. And this one is the real game changer. Vitamin number 3 is vitamin K2, the star. The third vitamin, and this is the most important one, is vitamin K2. I am willing to bet you have never heard of vitamin K2 in relation to leg muscle strength. Most doctors have not either, but the research on this nutrient is absolutely stunning, and it explains why some seniors maintain strong legs well into their 80s, while others struggle in their 60s. Vitamin K2 is not the same as vitamin K1. Vitamin K1 is found in leafy greens and helps your blood clot. Vitamin K2 is found in fermented foods and animal products, and it does something completely different. Vitamin K2 is the director. It tells calcium where to go in your body. This is the key to everything. Here is what happens as you age. Calcium starts depositing in the wrong places, such as your arteries, your soft tissues, and inside your muscle cells. At the same time, calcium leaches out of the right places like your bones and the structures that support muscle function. This is called the calcium paradox. You might be taking calcium supplements for bone health, but without vitamin K2, that calcium ends up weakening your muscles instead of strengthening your bones. Vitamin K2 activates specific proteins that grab calcium and shuttle it to your bones and teeth where it belongs. At the same time, K2 prevents calcium from accumulating in your leg muscles, which would cause stiffness, reduce strength, and impair contraction. A landmark study from the Journal of Bone and Mineral Research found that seniors who supplemented with vitamin K2 for 12 months experienced a 31% increase in leg muscle strength and a 26% improvement in physical performance scores. But here's where it gets even more interesting. Vitamin K2 works synergistically with vitamin D3. Remember how I said D3 activates muscle-building genes? Well, K2 makes sure that process happens efficiently and safely by regulating calcium. Without vitamin K2 high dose, vitamin D3 can actually pull too much calcium into your bloodstream, which can calcify your arteries and stiffen your muscles. K2 prevents this. It is the protector. Taking vitamin K2 at night is critical because it works during those peak muscle repair hours. While your body is rebuilding muscle fibers, K2 ensures that calcium is deposited in the structural components of your muscle cells, not floating around where it causes problems. Think of K2 as the quality control manager in a factory. The factory can produce as much product as it wants, but without quality control, that product is defective. K2 ensures that every muscle fiber rebuilt during the night is strong and functional. Here is what you will notice if you are deficient in vitamin K2. Your legs might feel stiff in the morning, like your muscles have not fully relaxed overnight. You might also notice that your legs feel weaker, even though you have not changed your activity level. That is calcium accumulating in the wrong places. Many seniors with K2 deficiency also develop persistent joint pain, especially in the knees. The calcium that should be in your bones is instead depositing in the soft tissues around your joints. The recommended dose for vitamin K2 is between 100 and 200 micrograms per night, taken with your vitamin D3. Make sure you are getting the MAC7 form of K2, not MAC4. MAC7 has a longer half-life and stays active in your body throughout the entire night. One major caution: if you are taking blood-thinning medications like warfarin, talk to your doctor before taking vitamin K2, as it can interfere with how those medications work. So now you have all three vitamins: D3 for muscle-building signals, magnesium glycinate for repair and relaxation, and K2 to direct everything to the right place. But how do you actually take these for maximum results? Let us talk about exactly how to use these three vitamins to rebuild your leg muscles while you sleep. First, consider timing. Take all three vitamins together, 30 to 60 minutes before bed. This ensures they are in your system when your body releases growth hormone and begins the deep muscle repair process. Some people worry about taking supplements before bed, thinking it might disrupt sleep, but these three vitamins actually improve sleep quality, especially the magnesium. Here is the exact protocol I recommend for vitamin D3. Take 2,000 to 4,000 international units per night. Start with 2,000 international units for the first 2 weeks, then increase to 4,000 if you are not experiencing any side effects. Look for a D3 supplement with added McDoyle, or take it with a small handful of nuts for better absorption. For magnesium glycinate, take 300 to 400 milligrams per night. Start with 300 milligrams and increase to 400 milligrams after 1 week if you are tolerating it well. If you experience loose stools, reduce the dose slightly. For vitamin K2, take 100 to 200 micrograms of the MAC7 form per night. This should always be taken together with your vitamin D3 as they work as a team. Many companies now sell combined D3 and K2 supplements, which can simplify your routine. Just make sure the K2 is in the MAC7 form and that the dosages match what I just outlined. A few important tips for success: consistency is everything. Your muscles need these nutrients every single night to repair properly. Missing doses means missing repair cycles. Set a reminder on your phone if you need to. Give it time. You should start noticing improvements in leg strength and stability within 4 to 6 weeks, but full results take 12 weeks or longer. Be patient. You are rebuilding muscle, and that does not happen overnight. Stay hydrated, as all three of these vitamins work better when you are properly hydrated. Aim for at least 6 to 8 glasses of water throughout the day. Finally, these vitamins work best when combined with some form of resistance activity. You do not need to lift heavy weights. Simple bodyweight exercises like chair squats, calf raises, or walking with light resistance bands will signal your muscles to grow. And these nighttime vitamins will provide the materials to make that growth happen. Let me address one more critical point before we wrap up. You might be tempted to skip one of these vitamins or to take them inconsistently. Don't. They work together as a system. D3 without K2 can cause problems. Magnesium without D3 will not rebuild muscle. You need all three every night. Your legs carried you through decades of life. Now it is time to give them the support they need to carry you through many more years ahead. Start tonight and watch what happens to your strength in the weeks to come.